Hey, Dr. Jones and RMU clinical team. I'd like to run a case by you if you have a few minutes. That'd be great. But before I get started with the details of the case, there's three clinical dilemmas that I want to run by you first, and we can kind of talk about that after. So, the first question: how do we carve out ADHD focus issues from trauma-related hypervigilance, which is the details in this case? Secondly, uh, autism is a possibility. So, what red flag should I look for in a 12-year-old female patient who masks these symptoms well? And lastly, and most importantly, what is the best way to pitch safer medication alternatives to an Adderall mother who's convinced that their child needs Adderall when they don't fit the patient's complex presentation at this time? So that'll take us into the demographics. So we'll say this patient's name is Anne. She's 12 years old. She came in with her mother to the office on Friday. Mom's reported her to have anxiety. The anxiety has been getting worse over the past few weeks, but so has her husband's PTSD. And he threw a TV across the room 2 weeks ago, shattered it. He also bashed his office after a work conference call, and then apologized to the family later. Nobody was hurt, but the family's all aware of his diagnosis. And since her father's been acting out, she's been acting out, doing kind of verbal outbursts where he was doing the physical outbursts. So with that said, family history: mom's got anxiety, her sister has anxiety, and the patient is not on any medications for the anxiety. So the differential diagnoses that we came up with were, we've got our general anxiety disorder, of course, F41. I came up with F43.21 is like an adjustment disorder with depressed mood, and that's in reaction to kind of how she's presenting with how the father is acting. They kind of go in tandem. So I also added a Z63.8, high conflict stress and primary support. Another one of the students was adamant that the patient met a F90.9 unspecified ADHD diagnosis, and I said I think we need a little bit more time before we can definitively decide on that one. I think we need to clear the smoke away first to see what's really starting the fire. And so I'd like to start this patient on Zoloft 25 milligrams first, follow up in 4 weeks, and then add in a non-stimulant ADHD medication if that's the case. But emotional dysregulation is also very rampant in this family, and so with a ICD-10 code of Z63.8, it would be really easy to get them counseling. Or get the patient, in this case, some counseling for the anxiety. That I think would be really helpful. So her inattention looks like hypervigilance. I suspect her meltdowns are actually an adjustment response to her father's behavior. Let's see what else here. Her vital signs are stable. Her labs were stable. She's well groomed. She's a little bit restless, a little bit fidgety, but otherwise calm, cooperative. She has a little bit of a lack of focus. She's slow to respond, a little bit to memory, but otherwise okay. Mood's okay. Pretty flat affect. If you ask her about school, she's like, school's okay, friends are okay. But just kind of polite kid. Let's see here. So I think it's important to avoid stimulants at this point and have a conversation with the mom about safer regimen. So I'd like your opinion on how to do that. Thanks so much, and talk with you soon. Bye.